day to you all, my wonderful followers. How are you guys doing? Welcome once again to Joyful Gist page, where we talk about health and a lot of things. So in today's video, I will be talking about infection in pregnant women. Most people don't know that pregnant women has more potentials to get infected in any ways. Anytime, any day, they can get infected easily because their body is very opened. So listen, because infection in pregnant women is very, very dangerous. Infection in pregnant women, if not treated properly, can lead to deafness, can lead to epilepsy, can lead to ear problem for children, and can also affect some parts of the body like the hand and the leg, which will make you see some children limping after birth. So please and please watch this video to the end as a pregnant woman to know how to avoid these kinds of infection. As a pregnant woman, the major infection they tend to have is uterine infection. This uterine infection is very, very common. It can happen during pregnancy, it can happen during labor, and it can happen after giving birth. So these are the three stages it can happen. When you are still pregnant, or when you are in labor, when you're having your child can get infected, or you can get infected. Now, how do you get infected during pregnancy? Don't forget, as a pregnant woman, you urinate frequently, and it's not every time you will be at home. Sometimes you might go out. So in the process of you leaving your house, sometimes that you want to go out and pee, you might pee at the wrong spot. So the heat gets into you and the infection starts spreading. And no, once you are pregnant, the first target will be your baby, and you start seeing bacteria going to where your child is, and before you know, they will get to the placenta, get where the fluids are, and they get infected to the baby. If not properly taken care of, it might lead to miscarriage in early pregnancy, and it can lead to a lot of side effects for the baby. Like I said, blindness, epilepsy, affecting part of some of the body, and it can also lead to ear problem like these hearing issues. And I said during labor, yes, that is why as a pregnant woman, when you are going to any hospital, make sure the hospital you are going to is clean. Make sure their environment is very clean. As a pregnant woman, when they give you a list for you to get your baby things, make sure you get every down thing. That is why when you are pregnant, the list contains Izal, Dettol, like some cleaning agent, especially antiseptic, to kill some kind of infection. You also see the doctors asking for elbow glove, about 3 types of glove. They have reasons for asking this kind of thing. So make sure you get this thing, because they will be using it for your baby. Maybe mistakenly, the bed they are putting you on has some bacteria, and because maybe you are already in a serious labor, they just want to attend to you, they put you there, you might get infected. Or maybe your baby is coming, might mistakenly catch some of the bacteria and might get infected. So you need to stop this. So how do you know you are infected during labor? Immediately after having the child, you'll be having serious headache, you'll be having fever, and if it's a smart doctor, it will ask you to go for some tests. And if they should look at you the next day after having your child, your vagina will have changed its color from the normal color to a very reddish color and very irritating color. I will tell you that, and they will start treating you. But in case you don't know, you have to continue checking yourself till you find out. Now, which is the third step? I said after pregnancy. That is after you've given birth and you're already at home. As a pregnant woman, as a breastfeeding mother, or someone who is still at home, your body is still open, especially the first 2 weeks you give birth to your child. The first 2 weeks, your body is very open. You still need to be using hot water, to kill some of the things. Dirt is still coming out of you seriously. Blood and everything is still coming out from you seriously. And some of you, once you give birth like that, once you stop seeing blood, you start having sex. It is very, very wrong. It will lead to infection because you are not yet done. Your body is still processing some things, so you might get infected. And if you are not properly taken care of, your husband might also get infected, and you will keep having infections until both of you go for treatment. That is you and your husband, because you guys met the wrong time. So as a someone who is breastfeeding a child, make sure you are using the right place. Like the toilet you are using is properly clean, the house you are staying with your baby is properly clean. You don't just open your body anyhow. The pads you are using, make sure is well kept. You don't just wear different kinds of pads that are infected, that you just pick from anywhere. It is very, very wrong. You don't just use different kind of water that you've seen in a bucket or rainwater. You fetch your water from a very clean tap. You use it properly. So it is very important that you understand, as someone who is breastfeeding a child, you need to be very, very careful with what you eat, with what you drink, with what you use on your body, because it might lead to infection, and it will definitely affect the baby, because the baby is still breastfeeding. So now, how do you know that you are infected after during this pregnancy? Number one, you will be having fever. You'll be having fever. When I mean fever, you'll be feeling cold, you'll not be comfortable, you'll be having fever. And by the time you get to the hospital, a doctor will ask you to go for treatment. I know what I'm telling you. Number two, you'll be sweating. Yes, you'll be sweating, and the sweating will not be a normal sweating, it will be having some kind of odor. Yes, the sweat will be having some kind of odor. So you need to go check yourself as well. Number three is tender pains from at the at your uterus part. You'll be feeling pain at your uterus part. You understand? At the side of your uterus. Any little time you'll be having cramps there, you'll be limping, you'll be having serious issues there as a pregnant woman. And the number four thing is you will notice it on your boobs as well as a woman. Just look at your nipple as a pregnant woman who is breastfeeding, as someone who is breastfeeding. Just look at your nipple, and once you look at your nipple, look at it in the mirror in case you can't see it, just because you can't bend. You will notice that your nipple is not black, it's very red, and is inching you. Your nipple will be inching you. Apart from the inching, if you are not careful, it might be bleeding. Yes, so that is a sign that you have infection, and it needs to be treated immediately. So as a woman, you need to be very, very careful. I mean, a pregnant woman, you need to be very, very careful with what you do when you're pregnant, especially the place you use to urinate when you're pregnant. As a pregnant woman, you need to be very careful with the kind of fruit you eat. Like I told you in my last video about pregnant woman, I said any fruit you want to eat as a pregnant woman should not be kept under room temperature. Any food you want to eat should be consumed immediately. Once it's caught, you need to eat it fresh like that. Don't leave it, because all these things might take some bacteria inside you, and it will start affecting you. As a pregnant woman, the clothes you wear, you need to be careful. You don't leave outside overnight saying it's not yet dry. As a pregnant woman, you need to wash your clothes, dry it in the sun, bring it inside in time, so that some bacteria will not pest on it, and then you wear it and it will get into your body. It's very, very wrong. As a pregnant woman, you need to make sure your nails are properly cleaned, so that some germs will not be, some bacteria, some fungi will not hide inside your nails, and in the process of you eating swallow or eating something with your hand, they will get into you. So you need to be careful as that. As a pregnant woman, you need to be careful of where you are sitting. You don't just go to anywhere you put your bum there. Look around. If you can have an handkerchief, clean your chair before sitting. You need to be very careful of what you eat as well. You need to be very careful of everything about around you, especially when you are still carrying the child and after you have the child. So have a lovely day, my wonderful follower. Do well to follow Jeffrey G's page for more interesting videos and updates like this. Have a lovely and wonderful week.